Research underway at the University of Colorado suggests that a powerful counter to Parkinson's disease may be exercise. Going battle with disease, technology plays a major, ever-evolving role. Advances abound in the form of new drugs, medical devices and gene therapies. But a decidedly low-tech treatment strategy for at least one disease simply requires putting one foot in front of the other, literally. The target is Parkinson's disease, a progressive movement disorder that affects around 1 million people in the United States and 10 million worldwide. While there is no cure, there are drugs to treat the symptoms of Parkinson's, including tremors, rigidity, and impairment of fine motor movements. But a growing body of evidence suggests that a powerful counter to this movement disorder may be, well, movement. A new nationwide trial that includes the University of Colorado is putting that idea to the test. Study in Parkinson's disease of exercise, SPARKS-3, is a randomized clinical trial investigating whether regular, moderate and high-intensity exercise can slow the progression of symptoms in patients in the early stages of Parkinson's disease who have not yet begun drug treatment. Dr. Corey Christensen is principal investigator for the SPARKS-3 trial at the University of Colorado. Photo by University of Colorado. Dr. Corey Christensen is principal investigator for the SPARKS-3 trial at the University of Colorado. Photo by University of Colorado. Groundwork previously laid. The study, which is underway at 29 sites in North America, builds on the findings of SPARKS-2. That trial concluded in 2016, with results published in 2018 in JAMA Neurology. SPARKS-2 was led at CU by Dr. Margaret Schenkman, then director of the physical therapy program and a pioneering investigator in using physical therapy to treat Parkinson's disease. SPARKS-2 divided early-onset Parkinson's disease patients into two groups that followed 4-day-a-week, 30-minute treadmill exercise regimens. One group elevated their heart rate to 65% of the maximum, the other to 85% of the maximum. A control group did not engage in a formal exercise program for the 6-month study duration. The study demonstrated that the approach was both safe and feasible for the people in the two exercise groups. It also showed that those in the two groups showed slower advance of the disease than those who did not exercise, as measured by the Unified Parkinson's Disease Rating Scale, UPDRS. A deeper look at possible benefits. The findings spurred SPARKS-3, a much larger study with greater geographical reach. This time, patients will be randomly assigned to two groups for 30 minutes of treadmill exercise, 4 days a week. The exercise heart rates for the groups will again be 65% and 85% of the maximum. The aims: further test the effectiveness of exercise in blunting the advance of the disease and which, if either, approach is more effective in doing so. We're not suggesting that exercise will eliminate Parkinson's disease, said Dr. Corey Christensen, assistant professor of physical medicine and rehabilitation with the CU School of Medicine, but the results of SPARKS-2 signaled that exercise can slow the rate of disease progression. Christensen is principal investigator for SPARKS-3 at CU and part of a diverse investigative team, CBOX. He co-authored the JAMA Neurology article on the SPARKS-2 trial and counts Dr. Schenkman, who is now retired, as a mentor. Dr. Margaret Schenkman, recently retired as director of the physical therapy program at CU, helped to pioneer the study of exercise as a way to slow the progression of Parkinson's disease. Photo by University of Colorado. Dr. Margaret Schenkman, recently retired as director of the physical therapy program at CU, helped to pioneer the study of exercise as a way to slow the progression of Parkinson's disease. Photo by University of Colorado. The much larger and farther-reaching SPARKS-3 trial will help to show if the study's exercise approach is generalizable to a broad population with regional differences, Christensen added. We might discover factors that differ between groups, he said. For example, people in Colorado are generally very active compared to other states, he noted. Careful patient selection and execution. Nationally, Northwestern University leads SPARKS-3, with a target enrollment of 370. At CU the goal is 24 patients, Christensen said. Study coordinator Catherine Balfany said that to be included, patients must be between 40 and 80 years old. Within the first 3 years of their diagnosis, not currently on Parkinson's disease medications, or slated to be within the next 6 months. Not enrolled in a structured exercise program, but healthy enough to meet the activity requirements of the study for 18 months. The trial also requires a brain imaging test called a DAT scan to confirm a diagnosis of Parkinson's disease. The test involves injecting a radioactive tracer that attaches to a protein that transmits dopamine. Dopamine is the neurotransmitter, or chemical messenger, that plays an important role in movement. An imaging scan then reveals how much, or little, of the tracer laid down roots in the brain. A small amount of tracer is consistent with low dopamine levels, an indicator of Parkinson's disease. Balfany said those enrolled in the study will be fitted for heart monitors with a chest strap. During exercise, they will connect via Bluetooth to their smartphone, which will display their heart rate as they churn through their routine and draw their attention to the percentage they should be targeting, Balfany said. Each study site, she added, will be able to view their enrollees' data, in real time, on a secure, web-based platform to make sure that individuals are staying in the proper exercise intensity range. Participants will also meet twice a month with study team members on the University of Colorado Anschutz Medical Campus to make sure they are maintaining and meeting the study protocols, Balfany said. Neurology incorporates exercise. These closely observed details and procedures are, of course, essential to meeting the standards of clinical research. But Sparks 3 builds on a now well-entrenched view that exercise is both viable and desirable to help people with Parkinson's disease manage their symptoms. As Schenkman observed in 2018 after publication of the Sparks 2 trial findings, the study shows that neurologists can rest assured that it's safe and feasible for their patients to exercise at a high intensity. That's huge. We can get people started right away on exercise habits when that is easier to do. That comment squares with the views of Dr. Jean Feuerstein, a neurologist and movement disorders specialist who practices at the UC Health Neurosciences Center, Anschutz Medical Campus. Feuerstein is study neurologist and site co-investigator for the Sparks 3 trial. What I always say to my patients is I can give you medications that will make you function as well as you can, but the reason I'm doing it is so you can exercise, Feuerstein said. That's the key for you to actually modify the progression of the disease. The Sparks 3 team. Corey Christensen, Ph.D., PT, Site Pi. Jean Feuerstein, M.D., Site Co-I, Study Neurologist. Wendy Court, Ph.D., Site Co-I, Exercise Oversight. Ed Melanson, Ph.D., Site Co-I, Physical Activity Oversight. Mark Monago, PT, DPT, Ph.D., Study Physical Therapist. Catherine Balfany, MS, Study Coordinator. Margaret Schenkman, Ph.D., PT, FAPTA, Professor Emeritus, CU Physical Therapy Program. Feuerstein said when she began her career 15 years ago by shadowing neurologists in movement disorders clinics, exercise was seldom emphasized to Parkinson's patients. By the time of her residency, however, that had changed. Exercise has been considered part of the standard of care for people with Parkinson's disease for at least 5 years, she said. Because of that, we now have more emphasis on specific types of exercise, a possible boost for quality of life. While Sparks 3 focuses primarily on motor improvements, Feuerstein noted that exercise helps with other Parkinson's symptoms, including constipation, mood disorders, such as apathy, anxiety and depression, and sleep problems. Mitigating these symptoms can help to improve quality of life and encourage people to engage with others. All these factors work together to blunt the undeniable challenges of the disease. I say to patients, we can think about this diagnosis as a time for you to take a look at your life and figure out new, healthy ways to live, Feuerstein said. Christensen added that Sparks 3 could give both patients and providers a roadmap for doing that, with something as simple and accessible as walking. It's easy to tell someone to exercise, but what kind of exercise? The study could offer clinicians the ability to be more precise in their prescription of exercise and the intensity, he said. And once you're dialed in as a patient, you don't really need to go to a physician to tell you to exercise. People will have the ability to be more in charge of their own